Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We are discussing Pranavasodas Vyadhi and we have discussed Swaraved in last two lectures. In today's lecture, we will move on towards another Vyadhi and it is called as Hicca or Hiccup. For diagnostic purpose, there is nothing rocket science in that. Patient itself comes with the symptom of Hicca. So, nothing to be special about the diagnosis. The special thing to be considered when the patient of Hicca is in front of you is always remember the Hetu 7. In clinical practice, you will find some Hetu as a particular Hetu to trigger the Hicca, and one of them is Rukshanga 7. Dry food or diet with no liquids, for example bread, toast like food, idli like food, and so such food triggers the hicca in the patients, and you have to ask the patient as a hetu of Rukshana 7 if he is getting the hicca recurrently. Second hetu, which is very commonly seen, is to eat very fast. I have seen the patient who finish their meals or lunch within 5 minutes, and that speed increases the vata dosh and vata prakop, and the hicca is seen. So Rukshana Sevan and Ati Shigra Bhojan are very commonly seen hetus. Along with the bhojan, drinking the any liquid vigorously is also acts as a main hetu of the hicca. Third hetu which is seen is vyayam. Vyayam in means if a patient particularly which do the pranayam, if they perform it wrongly, you will find there is imbalance between prana udan vayu and there is vikriti of vata dosh and hicca is seen in the patient. So if a patient is getting hicca recurrently, then these three factors are very important as far as clinical practice is concerned. Now other hetus are described in the text, Vidahi, etc. You can rule out them, but in my practice I have seen these three as a main cause, and you have to focus them on the hetus. Another one is eating cold food is another hetu which triggers hicca. I have seen the patient that he was having hicca for 1 month. When he came to me, he was having hicca for 1 month. Everything was tested. Even I gave medicine to him for few days, but he was not comfortable at that time. And just in talk, that patient said that he is drinking cold water continuously for 1 month, assuming that this is because of some acidity problem. I suddenly stopped the warm cold water and asked him to drink warm water, and there was immediate upashay. So Vataprabhak hetu, Ruksha, Shita, Ati Shigra are very much or improper vyayam, especially of pranavasadas like pranayam or yoga, etc., which disturb the balancing of pranavudan. All these hetus are very important. So to rule out these hetus when you are treating the patients. In treatment, again there are common kalpa, samirpadna, suchakar, etc. All of you, warm water, any warm thing, Vatanuloman, Dravya, Ushna, Snigdha are commonly line of treatment. Interesting treatment given by Charak Samhita, which is often ignored in the practice, is Vyatyasa Chikitsa. Charak Samhita has said that drink cold water and immediately drink warm water. Again cold water and warm water. This Vyatyasa Chikitsa in practice is very useful, and I have tried them in many patients. Now what is the exact action of this Vyatyasa Chikitsa? It is difficult to me to explain to you, but this hot and cold combination, immediate, works definitely. Second one, which is very interesting one, I have tried them in many patients, is Nasya. Panchendri Vardhan Tel or Anutel Nasya or even plain Gruta Nasya acts very fast and gives a very great results in the case of Hikka, and it makes the pranavayu normal. So this is the another chikitsa which is very useful. Then having plain honey, madhu, just lead the madhu, muhur muhur, as it is for pranavayu, and that coating of madhu on the internal area, internal mucosa, also gives a good results in the patients of Hikka. So these are the treatments which you can incorporate along with your routine medicines in the patients of Hikka. In the text, Gambhira, Mahati, Vyapeda, Hikka are described and which are generally seen as a Arishta-Lakshana. I have not seen in the patients this Hikka as a Arishta, or I have not seen this type of Hikka, but I will give you lectures and my experience of Ayurvedic which are seen in the, or I have seen in the patients during the course of the time. So mainly you find the patients of Shudra Hikka and Andaja Hikka, and which is related to this Hetu which I have described just now. By other means, Hikka is very easy for diagnosis and for the treatment also. Just focus on the Hetu Parivarjan, and you can add this chikitsa of Nasya, Vyatyasa, or just letting Snigdha Madhura Rasa also helps to cure it very fast. We will come with the next topic in the next week. Thank you very much.